Hello, I'm Elna Rudolph, and it's a great pleasure for me to welcome you to the third webinar of the World Association for Sexual Health for 2024. Welcome to all of you from all over the world. I know most of our guests today are from Europe because you're interested in finding out what we have for this European conference that's coming up. But please let me know where you are from. I'm from South Africa, and I am joining you from the beautiful winelands in South Africa in Stellenbosch. And our executive director is in Pretoria in South Africa. Michelle is in the middle of our country from a farming community called Lichtenburg. Please let us know where you are from. I would also like to remind you that we have made two big announcements in WAS recently. The one is about the theme for World Sexual Health Day, which is celebrated on the 4th of September every year. And this year, our theme is positive relationships. So you can do with it what you want. We've got fantastic resources on our website. There's now an official website for World Sexual Health Day. I will share it in the chat when I'm done. But you can please host local events, engage your own community, use all of the wonderful resources that WAS has put together through our World Sexual Health Day committee, and join us in the celebrations of positive relationships this year on the 4th of September. And then also, we've made the announcement that our next conference will be in Brisbane, in Australia, from the 16th to the 19th of June next year. So it was 2025, will be in Australia. So please put it in your calendars. The abstract submissions will open soon. Come and tell us about your research. Come and tell us about the work that you are doing in policy making and activism and education. And then, of course, also clinical services. We'd love to hear from you. But first, we have a very, very, very important conference coming up now in Bologna. Our bags are just about packed. We will definitely be there supporting our official federation in Europe, the European Federation of Sexology. WAS now has 6 official federations, and the FS is one of our founding federations. They've been with us for a very long time, and there's a lot of fantastic research, of course, coming out of Europe in sexual health. So today we are honored to have them with us and to come in and tell us about what we can expect from their conference. I just want to see here in the chat where everyone was saying hello from. So we have hello from Rome, but originally from Finland, more Rome, Botswana, Australia, Denmark, Canada, Brazil, Eswatini, meaning our neighbor here in South Africa, Belgium. Wonderful. It's great that all of you are joining us today. So I am going to introduce you to the president of the European Federation of Sexology, Mehmet Sungur. He's a professor of psychiatry at the Istanbul Kent University. He received training in cognitive behavioral therapy, sexual and marital therapies at the Institute of Psychiatry in London, and he is accredited as a cognitive behavioral therapist by the EABCT. He is a founding fellow member and a certified cognitive therapist and supervisor of the Academy of Cognitive Therapy, and he's the president of the International Association of Cognitive Therapy, and has been a past president of the EABCT. His clinical practice covers a wide range of clinical syndromes with special emphasis on cognitive behavioral treatment of anxiety disorders and sexual and marital problems. He has presented workshops and keynotes in many international congresses, and he's played a leading role in the dissemination of the practice of CBT and sex couple therapy, both in Turkey and abroad. He is the president of the Turkish Association of CBT and since its establishment, and the recipient of national and international awards. He has published more than 100 papers and written books and book chapters on CBT. He is on the advisory and editorial boards of many national and international journals and has currently committed himself to the training of mental health professionals in clinical application of CBT and couples sex therapy, both in Turkey and abroad. And he's been the president of 8 international congresses and many national congresses, including the previous WAS Congress that was held in Antalya in Turkey in November. Mehmet is, of course, also an executive committee member of WAS as the president of one of our official federations and an advisory committee member of WAS. Mehmet, it gives me a great pleasure to hand this over to you now. I am so happy that I am not the president of this upcoming Congress. I needed a break still after our previous Congress that we organized together. So thank you very much for taking the lead. I know you've got a very strong local team that's helping you to organize this Congress, but thank you for taking the lead, and I'll hand it over to you.
Thanks very much for this kind and generous introduction, Elna. And thanks very much for joining us during the Congress and at this webinar that we are holding today. I'll start by introducing EFS for those who are not familiar to our association. EFS, which is European Federation of Sexology, as you said, is a regional federation of WAS that represents Europe. EFS is an umbrella association which covers more than 60 member societies and many individual members. EFS recognizes sexology as central to human life and also promotes sexual health, well-being, sexual rights, and justice without leaving anyone or any groups behind. We, as board members of EFS, believe that issues like sexual rights, sexual responsibilities, sexual justice are no longer luxuries, but essentials to live a life in dignity in a world where polarization and discrimination dominates most of the policies which are embraced by many different governmental organizations. On top of that, EFS promotes good and ethical practice of sexology and sexual therapy in education, in training, in skills building, and embraces diversity with compassion, free from prejudice and violence. EFS hosts congresses in different parts of Europe, and the next one that we are going to have will be held in the beautiful city of Bologna between the 23rd and 25th of May this year. And obviously with the theme Sexuality in Health and Disease, Sexual Health, Rights and Well-being. The EFS and our hosting association, which is the Italian Center of Sexology, GIS, has organized a high-quality congress which hopefully will turn out to be a memorable congress, both scientifically and socially. The congress, just to make a brief introduction, because I guess Charmaine will talk more about this, but the congress consists of 62 sessions that consists of lectures, consists of symposiums, workshops, roundtables, open papers, and of course, poster sessions. We believe that the scientific success of a congress depends on the contribution and active participation of its delegates. So therefore, I hope that most of you, if not all, will be able to attend and be actively involved in this congress. On behalf of the scientific committee and on behalf of EFS, I'm looking forward to seeing most of you in Bologna to meet your old friends and to make good new ones in the warm and friendly atmosphere of EFS and also under the warm hospitality of the Italian Association. So hopefully you will be there. Come and join us, please, because that is going to be a wonderful congress. At this point, I would like to close my talk and actually give the platform to Stefano Eleutheri, who is a great friend, of course, first of all. And apart from that, he's a psychologist, a PhD one, and a therapist, a sexologist, member of the advisory committee of WAS, and also a board member of EFS. He is involved both in research and clinical practice, and he will talk about the theme of the Congress at the moment. So platform is yours, Stefan.
Thanks a lot, Mehmet, for the introduction. It is great to be here and to be able to present the theme of the Congress. So this is the presentation, the slide presentation of the Congress, and you can see that the theme is sexuality in health and disease, sexual health, rights, and well-being. So, of course, this is a broad theme. So in the short presentation that I am going to have, I would like to present something from the scientific point of view, why this theme was chosen and how it will be embedded in the program that Charmaine will present more. So, of course, when we talk about sexual health, we talk about the definition by the WHO in 2002, where the sexual health has been defined as not just the absence of disease or infirmity, but a full sense of well-being from a psychological, biological, and sociocultural aspect. So, of course, when we talk about sexology, we have to talk from a biopsychosocial approach. In this diagram, you can see that, of course, when we talk about the biopsychosocial approach, we talk of the connection between all these aspects that can influence each other in both directions. And of course, also the fact that these are present both in healthy situations, but also in the illness periods or situations. So, of course, we are talking of something that are really broad. What is the new of the biopsychosocial approach? That in contrast to the biomedical model that suggests a direct link between every pathological process and a possible explanation from a biological point of view, and also the fact that the normal function is different from the deviation that is underlined by the pathological process. We can see that in this approach, everything is more complex, and the theme of the Congress will be concentrated in this approach. We can see that the father probably of this approach is Engel. You can see here his photo and a sentence that for me is really important because it represents the essence of this approach. He said that the challenge, but also the reward of the doctor is to make meaningful connections between the patient's life history and the problems he or she presents in order to diagnose the difficulties with which the patient presents. So as you can see, we are talking also of personalized medicine, an approach that not give the pathology the more important emphasis in the diagnosis, but to the perception of the patient and also to the possible explanations that the pathology and the etiology may represent for them. So, as you can see, these were the traditional vision of sexual dysfunction, where on one side there were the psychogenic sexual dysfunction with a psychological etiology. On the other side, there were the organic sexual dysfunction with just a biomedical etiology and a mixed etiology that mixed both these factors. But in the modern vision that will be presented as a theme of the Congress, we can see that they are interconnected between them in a circular way. So, of course, we have the sexual function, we have the biological aspect, we have the cultural and social that are differentiated between them because they are, of course, interconnected, but they can present different ways in which things are interpreted and shown. Of course, we have the relationship, if we have a relationship, and of course, the shape and the form of the relationship will have an influence again in the way in which the sexual problem will be presented. And we have again the psychological aspect. You can see that in this way the sexual problem is more difficult to interpret and to manage, and for this reason a lot of aspects during the Congress will represent all of these aspects and different corners of observation that can help all the professionals from the biological, from the psychological, but also from the social sphere to interpret and to collaborate, of course, with the others. So what the biopsychosocial approach want to challenge is this kind of approach. So the idea that for an organic dysfunction, we have just a biomedical treatment, that for a psychogenic dysfunction, that just a psychosocial treatment, and that the relationship problems are just solved with counseling for the couples. So this is not an approach that seems meaningful and effectiveness. On the other side, the biosocial approach posits that all dysfunction sociologies and outcomes can involve some combination of all these factors. And in order to better understand this, we have to provide a comprehensive assessment and treatment that can account for the biological, psychological, and social aspect of a sexual dysfunction. So I'm arriving to the end of my presentation. The biopsychosocial approach requires always flexibility and cooperation between different actors of the treatment. And for this reason, you will see that in the program, we will have different kind of professionals in order to show how all these professionals are important in understanding and treating sexual problems. Last but not the least, of course, it is important, and in the team you can see that we talk also of sexual rights, because of course sexual rights contribute to the way in which sexuality is perceived from a social point of view, and so they influence the way in which of course the person can understand their sexuality. So here in this slide, I put two of the most important declarations promoted by the WOS, that of course also in the EFS we follow and disseminate, the Declaration of Sexual Rights and the Declaration on Sexual Pleasure. But in the program, probably Charmaine will also say this, you will have also the opportunity to contribute to the Declaration of Sexual Justice, that is the last declaration on sexual rights that the WOS is paying as participating to, always involving all the participants to the congresses. So I hope that I will see most of you in Bologna, and I thank you for the attention. I leave my contacts for every need. Thank you.
Okay, thanks a lot, Stefano, for this presentation, which outlines the theme. And also thank you for referring to the concept of flexibility, which is the most important issue, which is neglected most of the time, because every pathology, including physical ones and psychological ones, comes from inflexibility, rigidity. So I think flexibility is a very important issue that needs to be discussed further. So thanks a lot. Now, it's a great pleasure for me to introduce Charmaine Borg, who is the Vice Chair for the Scientific Committee. Charmaine, welcome, first of all. And to introduce Charmaine, I was really surprised that you had your training at the Institute of Psychiatry, where I had, but mine was decades before yours. So it's great to, well, thanks for, devoting your precious time for organizing such a wonderful scientific program. So first of all, thanks. And Charmaine is, as I said, had her training at the Institute of Psychiatry, London, and she's both involved in CBT and also sexual research and sexology in practice, clinical sexology as well. She's very much interested in women's mental health, and I believe that's a very important issue again, which is neglected. And Charmaine is going to tell us more about the scientific content and what are the sessions, what the sessions are like, and what we are likely to offer to you when you attend to our Congress. So the platform is yours.
Thank you, Mehmet, for that introduction. First, I would like to make a short disclaimer that I'm with a fever at the moment, so I hope you bear with me and that I can do justice to the flavor, to give you a flavor of this presentation about our upcoming EFS Congress. So my role here is about introducing, rather than introducing, giving you an idea of what is the scientific program and what went into the thinking behind designing this program. I did this together with the scientific committee, of course, of the EFS, and there, in the last weeks and months, a lot of work behind the scene has been conducted. You can move the slide, please, thank you. And our aim was to build a solid but also innovative and enticing scientific program, right? I mean, the way we were thinking, that we wanted to base it on what we know worked in previous EFS congresses and other conferences, because most of the members of the scientific committee do have a lot of experience with organizing conferences, and we're all very active in attending sexology congresses. So we kind of wanted to keep what is solid and what we know works. And I will link what is the more traditional aspects of the program, and also wanted to integrate new ideas in the program to allure both the long-term attendants that are always there and the new people from different disciplines to come. And I think this ties very well with what Stefano was saying, that sexology, I believe it's really a dance between the brain and the body, right? There's so many multidisciplinary team members that can contribute to really helping and improving the sexology, like for the clients, but also for scientific research, etc., etc. Now, you can move the slide, please. And again, yes, so we have what you are all used to, the open papers, and we took a decision here to focus on increasing the time of the open papers. And we deliberately chose this to make it a bit longer, kind of to give the opportunity for the presenters to be able to explain the content. So for the attendees to enjoy and understand better and to go home and apply and what they have learned already, but also for the presenters to feel that they could communicate their message. Because I feel from our experience that sometimes these 5 minutes presentations, they are so rushed, and that if you are not an experienced presenter, and maybe sometimes even if you are an experienced presenter, you will have difficulties to really put your message across. So we wanted to be sure that we make them slightly longer to accommodate both the presenters, but also the attendees. Now, this time we kind of, for all the programs, we took a different stance. We kind of, give me a moment, yes, for all the activities in the program, what is this different stance, right? Looking back at the EFS conferences, we feel that perhaps we're representing largely the sexology, but we're forgetting perhaps other members of the multidisciplinary team and other aspects of sexology that are equally relevant. So we started by reorganizing our field of sexology into subdisciplines, and these are the pillars of our Congress. We said that the clinical sexology kind of was the basis of our Congress, but we also want to give relevance to education and sexual health promotion, to sex research, fundamental sex research, and to policy on sexuality and relationships. So all the scientific program, including the lectures, the workshops, the demos, and I'm going to explain all this, the open sessions, I'm not sure if I mentioned it or not already, but all the scientific program is equally distributed on these 4 pillars. And the last one, the policy and sexuality and relationship, I think makes room for aspects that perhaps in most sexual conferences, especially in the FS, that's kind of the topic at hand now, was slightly neglected. And we wanted to restructure or perhaps increase this attention to these aspects, to also increase the participation in our Congress, of course, to make it more open for other members of the disciplinary team. Now we have the open symposium. It's again quite traditional, and you're all aware of what open symposia are. They are slots of 60 minutes for which attendants can come together as 3 speakers, generally with one subject, with one kind of connecting topic. And again, every aspect of this Congress is equally distributed on these 4 pillars that I just discussed with you. Now, we have the demo sessions, and the demo sessions are... Now, sorry, I forgot to tell you about the... I'm not sure if I can go back, but I don't need to go back. I can just explain it. For the lectures, because the lectures are also quite relevant, we had a number of people that wished to join the EFS as a speaker. We also had people contacting us, but what we wanted to do is to, instead of always inviting the most kind of, how can I place it, the most popular speakers that we always invite, we wanted to look a bit deeper and go a level down to also invite speakers that are in the middle of their career. So this is something that when we were designing our approach, who are the speakers that we wanted, we thought, of course, we want speakers that fit with the novelty and the breadth of our choices based again on the pillars. So encompassing different teams and disciplines, but also wanted people that are able to transmit their messages in a versatile manner, in a capturing manner, because we strongly believe that the message can make a big difference depending on the presenter. And if they can have clinical experience and research experience, they had a preference. We were not restricted ourselves to sexologists and psychologists, but we opened the platform for psychiatrists, gynecologists, urologists. We really tried to have a bigger breadth than we previously did, perhaps. Now, for the demo session, I need to check the time to make sure, okay, I'm still on time. The demo sessions are more novel, perhaps, in the EFS. And we wanted to offer the opportunity to make things get practical, ensuring that participants can go home with stuff they can apply to their work. And this program then allows for demos on clinical sexology, on education, sexual health and promotion, again on the 4 pillars. And in the demo session, we allow the participants to become more proactive, that they really engage more with the material presented to them. And I believe some topics, or we believe, I must say, some topics fit best with a demo session. Yes, and now another novel aspect that I feel it's novel, and I am very, I would say we're proud of this aspect. We are introducing the speed dating, the scientific speed dating in the EFS relatively early in the program, and this is because we want people to come to the Congress not only for the content, and maybe this comes across a bit strange if you want people to come not only for the content, but we want them to come to a community that they feel they belong, that they feel they are part of. So it's not about only the content. The content is very important, but we want even more than that. We want students that are in the beginning of their career. We want junior scientists, junior professionals that are really in the early stages, that they feel that they have a bigger community they belong to, that they have people that they look up, that they can answer their questions. And this idea, which we are now in the final stages of developing it, we selected some people to be part of the speed dating that we believe they are versatile, that they love communicating with people, that are full of energy, and that are some strong on the clinical aspect, some strong on the research aspect, policy, some on education, etc. So we offer the opportunity for people to have these burning questions, perhaps that have more difficulty in putting these questions in a lecture hall. But when you have an intimate environment like that, you can quickly ask these questions and have your questions answered, hopefully. We did it early in the program because we believe this is important to make the cohesion happening. And I've been to some conferences in the last months that I've heard in the grapevine that some people said even directly to me, we don't come to this Congress only for the content, but it's really for the feeling of having this sense of belonging. And this is exactly what we want to put forward in our Congress. The last slide, yes. So for me, before I conclude, I hope I gave you a bit of flavor of the what went behind our thinking, right? Like why we decided to keep some aspects and to add new aspects. But the most important is that you need to be there. As Mehmet emphasized, you need to be there to make this happen. So the program is there, and what we can say is that we promise to make it a successful story, but this cannot be done without you. So if you have the opportunity to join us, I really encourage you to join us, because it's going to be a fun and successful, good learning experience, I would say. And Bologna cannot get better than that. So thank you, and yeah, I hope to see you there and to meet you in person.
Thanks, Harmain. You mentioned about the 4 main pillars, which are very important: clinical issues, research issues, and also education training, and most importantly, policies, which are quite in fit with the policies of World Association of Sexual Health. So that's great. And the other thing is what you mentioned, which is new for us, is the speed dating. I don't know what that brings in. I mean, dating in the sense of dating could be possible as well, I guess. And so we are free. And on top of that, I think it's very important that you emphasize the importance of being face to face. That's the reason why we have the Congress face to face rather than virtual, because people do not only go there to learn, but also to have bigger networks. And our worlds are only as large as our connections. So this brings us with connections. Thanks a lot. Thanks for devoting your time. So now it's a great pleasure to introduce you another friend and also a board member of EFS, who's Patricia Pascual. And Patricia is an associate professor at Lisbon, and she's both a CBT therapist and also sex researcher and sex therapist, and also a supervisor, and very much involved in research. We know her from her wonderful research papers and so on. And on this occasion, she brought a new concept, which was not very familiar to us in the history of EFS, which is the Best Presentation Award. So she's going to tell us more about this. And the platform is yours, Patricia.
Hello, good afternoon. Good afternoon to everybody. It's lovely to be here surrounded by this incredible team. and these incredible people that I admire so much, and with such great attendance. It's so lovely to see how communicative and supportive people are being in the chat. So thank you so much for being present with us. I think what I want to tell you comes a lot in line with what Charmaine has already said. We were so surprised as a team that we received so many diverse papers with such high quality. I have to admit, in the beginning, we were thinking, oh, there are so many great meetings in Europe this year. Maybe Bologna is too hot. Maybe people prefer other things. And in fact, what we got was a lot of really great proposals, and Charmaine and Sam have been leading this difficult role of choosing papers and dealing with the grading and the abstracts, assuring there is diversity. It's been hard work for the scientific committee. And I think because of that we were discussing so much about diversity and quality and how we want the European Federation meeting to be inspiring for people and create some kind of branding also for future meetings. I proposed, and this proposal was really well received, that we would have a prize, that we would start the tradition of having a prize. This is not a new idea. Because there are prizes in different meetings, but we didn't have this tradition. And what we really wanted was to create room for those who are presenting great work to be rewarded. And also for the people who attend the meeting, that they are inspired by this great work. And they say, oh, I really like this presentation too. And now this person received, or this research team, or this team of clinicians or educators, they receive a prize. So, even the people who are watching can relate to great work and feel inspired and say, well, maybe next year I make a proposal, or next occasion I will make a proposal of a great moment and a great prize. So this is our early motivation at this stage, that we can reward the best presentations, and that these presentations are an inspiration for future submissions, and that we create a good environment among people. So how are we selecting the presentations who will be the presentations that will be a focus of in interest? So we decided that we would choose the ones who have received the best grading, and among those, the authors will be reached soon and will be invited to be participating. So let's suppose somebody has a great grade, but it's not interested in this kind of prize environment. Okay, then we choose the other one. So the people who got the best grading will be invited, and after that the presentations will be evaluated. We want to make sure there is diversity of themes and of methodologies and of work. So we are working hard on selecting really good presentations that are in line with these pillars and these concepts. And how will this happen? You may think, oh, who is going to be there evaluating? Are they going to take notes while I'm presenting? No, we'll just make sure that the team, there are at least 2 evaluators for each presentation that is eligible, and that the grading is anonymous. There is no tension put on people, and of course there is no conflict of interest. So people who are in the jury will not have their own work illegible. Okay, we don't want that kind of conflict of interest. We don't really don't want self-serving prizes, like people who are in the scientific committee are receiving prizes, or people related to them. So we will make sure that is not happening. And we have criteria that are linked both on the quality of the presentation, the content on one side, but also how engaging the presentation is in terms of communication of science, or communication of ideas or programs or projects. Who will be evaluating? Well, I am the visible face of a team that will remain anonymous, we hope, until the end, to make sure that the process is as clean and clear and non-conflictual as possible. But you will know who the rest of the people are. And what is the future? So what is happening in the future and what are we trying to build here? We are trying to build the possibility that, well, first people are rewarded for their hard work. That's really nice. But also that maybe in the future there is some financial compensation. We could not get a sponsor yet. So if you want to sponsor the prizes, yes, you're welcome. But that we have sponsors for the future editions, that this is not only symbolic, but that it translates also in some kind of financial compensation. We also aim to decide if we will have tracks, specific tracks, because now it's quite global. It's only best oral presentation and best poster presentation independently of the themes. So maybe in the future we will focus on specific tracks to make sure that all the pillars are contemplated. And we also, and I would personally would really like that, to devise a mechanism where the audience could also participate on the voting. That of course is not simple, because we have to make sure it's a process that doesn't create conflict of interest, etc. But that we make it as democratic and participated as possible. So summing up in some few sentences, we are aiming to reward quality, we are aiming to reward diversity, we are aiming to reward all those who work hard to make our meeting the best meeting possible. Thank you, and I hope to see you there and present your ideas for future prizes with me if you want. Thank you, Mehmet, for your kind
Thanks, Patricia.
presentation.
Thanks a lot. It's important. It's a different concept that we have brought in. And when we are awarding people, I would like to remind all that actually you're not competitors, but completers of each other. So in that sense, every work deserves award, but we will try to get the best one. But of course, that will depend on very different factors, and whoever gets the prize or prizes are the ones that we reward, but we reward all of the people who come and present. So just, I wanted to emphasize that every work is valuable, every work is a contribution, and we need your active contribution to turn this ordinary Congress into a memorable one. Thanks, Patricia. So, as the last but not the least, I'm going to introduce now Stefano Bernardi, who represents our local host, which is the Italian Center of Sexology. And Stefano is working hard on it with Maria Cristina. And Stefano is a licensed psychologist, a therapist, a clinical sexologist who represents our hosting association. And he's also a board member of the Italian Society of Human Reproduction, specialized in fertility. So I'm sure that you're going to offer us a warm welcome. You're going to make us feel like we're at home. I know that the Italian hospitality is popular. So let's give the platform to you to tell us more about the venue and its surroundings.
Hello everyone. Thank you, Mehmet. So I am proud to introduce the next venue for the 17th Congress of AFS. The venue is Bologna. Bologna is the capital of the region. Just a minute, the echo here. Bologna is the capital of the Emilia-Romagna region, is the region in middle in Italy. In Bologna, you can feel the academic atmosphere, because Bologna is the world oldest university, founded in 1018. So many activities there are in Bologna. No, you can think about Ferrari, you can think about Maserati, you can think the motor, you can think the cycle. Bologna is also anche di music patrimonio UNESCO. And the university, is founded in 1088. It's the oldest university. Many students visit Bologna. Many students studied in Bologna. Two words about CIS. No, CIS is the local committee. No, CIS is the first Italian society in sexology, and CIS is a member of EFS, a member was as member of Federation Italian Medical Scientific Society, and a member of it, Italian Federation of the Scientific Sexology. In this Congress, there are in the present also the major Italian Society Scientific. About you can see CIRU, you can see SIA, you can see FIS. CIRU is the Italian Society Human Reproduction, SIA is the Italian Society Andrologist, and the FIS is the Federation for Italian Society Sexology. The Congress will be in Royal Hotel Carlton, is in the center of Bologna. It is an ideal place for work, the ideal place for visit Bologna. For the social dinner, we can try the Cantina Bentivoglio because it's the traditional flower in unique location. No? Cantina Bentivoglio is traditional Bolognese restaurant and the traditional Italian food. But we have a gift for us. We have a gift is a nice work for the street in Bologna. It is invite you to working in tour in Bologna with the first event for the see the town. You can see the Palazzo. Palazzo, I don't remember the name, sorry for the emotion. Le Torre degli Asinelli and the other structure. For the Congress, there are a gift for the 17th Congress of EFS, and the gift is an exhibition, an artistic event during the Congress. The name of this artistic event is Luci di Vita. We wanted to see, and we want to invite everyone to see in Bologna in 2024, in May 23 and 25 May. So just the time Italy will come, and Italy wants you to see, to visit Bologna and participate of the EFS Congress. Thank you.
Okay, thanks so much, Stefano. We know, I mean, I've already been there, so I know all the facilities, and I know it's impossible to talk about all of the wonderful venues and, you know, not only Bologna, but the surroundings are also very nice. And you're having a very nice social night, as far as I know. So thanks a lot for being the host, and I wish you all best for hosting lots of people coming from different parts of the world. Thanks a lot.
Thank you so much to Mehmet and all of our wonderful speakers. Now, I've been looking forward to coming to Europe very much, but after hearing this talk, I'm really looking forward to coming, and both for the beautiful surroundings and the interesting things that will be happening at this conference from a scientific and a social perspective. So thank you so much for sharing that with us. I appreciate it. Shall
Thanks a
we
lot
take any
for-
questions from the audience? I see here that Nadia asked if there might be people in Bologna that will be willing to do some couch surfing options for people that might be interested to come and cannot afford that, because I must say the prices for the hotel in Bologna was high. So I can understand that some people might want to have other options. So maybe if you can, what would you say? What would be the best place? Or maybe Stefano, Bernardi, maybe you can say, if people to talk about accommodation options, would it be to contact Prodromos at the PCO?
Yeah.
Could you maybe share a contact information here on the chat, please?
I guess apart from the hotel, which was promoted in our website, there are other options, but as I'm not the local, so I can't answer these questions. But I'm sure that there will be accommodation for, you know, students and for other people as well. So it's best to ask the PCO, and here's Ramos's email, who's the PCO for the Congress, and he will be I'm sure he will be happy to answer all of the relevant questions.
I can say in Bologna there are many hotels, and near the Carlton Hotel there are many possibilities for the hospitality. They very for all the requests. For there are hotel in three star or 4 star. There are many possibilities to sojourn, to visit, and to stay in Bologna.
Thank you, Stefano. If there are more questions, you're welcome to put it in the Q&A anonymously, or you can put it on the chat, and our organizing committee here can see what they can answer for you. I'm just thinking now, what's happening to me is what's happening in the life of so many sexologists. You know, I'm in my practice. While I'm busy in my practice, there's a counseling session taking place just here. We are doing hair removal for a transgender patient. We're going on to another business meeting after that. But I think that's the life of a sexologist. We all have so many different balls that we are keeping in the air. You know, we want to keep our up to date with the most recent research, and we want to be excellent clinical practitioners, and all of those things come to play. But a conference is the greatest place to bring all of this together, because we need support from our colleagues who know how we feel. And it's so nice to go to an international conference or this one being a regional conference, where you meet those colleagues who know exactly what it feels like to stand in your shoes. And while you are there, having a good relaxation and socialization time, you're also getting cutting edge research. I remember seeing Charmaine at a conference in Europe. Probably this must be 10 years ago already, Charmaine. Both of us were very young. But when you presented on the first time I heard of the concept of disgust in sexuality, you know, and it was mind blowing. And I came back to South Africa and told my colleagues about it, and none of us had ever heard of it. And that came out of a conference, and it changed the way that we practice, you know, because once this disgust is triggered, there is a different route that you follow in therapy. So I can attest to the fact that conferences are not only fun, it also changes the way that we practice, actually.
Thank you so much for saying that, Elna. Means the word to me, so I appreciate very much. I remember you actually coming to talk to me. I was, blown away, yeah. And by the way, I'm coming to South Africa and to Stellenbosch next week, so maybe we shall make contact, eh?
Yes, of course.
Yeah,
Wonderful.
so I will
Please.
email.
Okay. Yes,
Yes,
please.
there's a CBT Congress in South Africa soon, which is coming up. And although I wouldn't be able, are you attending to that one, Charmaine? I don't know.
No,
No.
I'm coming. I'm going for work/holiday for 2 weeks and a half.
Okay.
Yep.
We are just to inform you, we are actually trying to establish the South African Association for CBT, which is a new concept, because we have a world association and the only missing continent was Africa. So now we are going to have an association which is going to join us at the World Confederation of Cognitive and Behavior Therapy. So that's great. So regarding our Congress, I think it's as you mentioned, Elna, both socially and scientifically. Of course, it's going to be cutting edge research and also clinical skills, not only knowledge, information, but also skills, which is quite important to build up. And I think it's a great chance to network, and that speed dating thing I'm interested, which I have never heard of. And I hope that's going to be successful as well. That will give people opportunity to meet and also give chance, you know, the open papers, the lectures, as Charmaine has mentioned, will give opportunity to newcomers who would be the leading people in the long run, I hope. So it's great that we gave the chance to younger people who deserve to present their work and who deserve and be appreciated for the contributions that they have made. So we're still open to, I think, the posters are still possible to be submitted. Is that correct, Charmaine?
I believe there is no limit to the poster presentation because there is sufficient space for that, as that the screen will keep changing. So I would not believe there are limitations at that level.
Okay,
Maybe a
great.
point that I would like to make, if there is space, is that kind of in this Congress, I'm relatively new to EFS, I must say, compared to the other members, because I was more involved in other sexual conferences and societies. However, I do feel already part of the family and an active member, I would say. But what I think is relevant to mention is that we worked hard as a committee this year to identify what makes this Congress worth it, and perhaps not more relevant, but because we're not in a competition, but say some conferences or congresses are really focused on one specific professionals, right? Like urology, for example. But we kind of wanted to identify what are the characteristics of FES and keep that, but also encompass the broadness of the other factors that we usually forget, or we don't give the right relevance for that, or the right space for them. And I think this is important to keep in mind, knowing that in Italy is very special. I come from a place close to Italy, so I feel a bit Italian in my heart. And I think the two conferences, the European conferences in sexology, are happening in Italy this year, one already in February and one now. So we wanted to make sure that we can highlight the speciality, the uniqueness of the EFS, to make it worth it for a broader participation rate this year. And I think we were I can add that we were relatively successful in it, but still we would like to encourage those that are not joining to do the last effort. Yeah.
Thank you, Charmaine.
Just
I
to mention,
wanted
we
to-
have a large number of attendants at the moment, and
Yes.
that's much more than the previous ones. So that is a kind of success even before the Congress starts. I will not mention the numbers because I'm not sure about it, but we have exceeded 450, which is great. And we have another more than a month to start the Congress. So we are hoping that we are going to be over 500 by the end of the time. So
Wow.
that's great. And hope that these people who attended today, thanks to all of them who attended, and we hope their active participation, and we will be at your disposal to do the best we can to offer you a very good scientific program and also social events. Any other questions, Elna? Do you see anything or?
I see someone has put a hand up, but we cannot accept the hand up. So if you can just put your question in the Q&A or in the chat, then Zainab, then we can look at your question there. I had a question for Patricia Pascal, because Patricia, you are very much involved in many organizations that relate with sexual health, now very much with the International Society for Sexual Medicine as a psychologist, but you also put your energy into EFS. So what is it that makes the EFS different from other conferences? You know, if you can only attend one sex conference in a year, why would it be EFS, would you say?
That's a great question. I actually was thinking when you were mentioning you met Charmaine 10 years ago, I was like, suddenly, oh, I've been around for such a long time and I've been active in so many sexual health congresses. I think there is a special feeling about European Federation, to be honest, a bit like WAS, that, and I think maybe Charmaine, we can discuss about this later, like the academy meeting, the sexual medicine meetings, they are really focused on very specific things. If you go to the academy meeting, they are really, oh, the greatest research, most updated methods, and you're suddenly like, wow, this is hardcore research, this is so inspiring. And then you go to other, like the sexual medicine meetings, and it's new developments, new equipments, and new therapies. And then suddenly we have the European Federation, and you see activism, you see community engaged work. And I agree with Mehmet. In a way, it's an award to be there, but it's also award to receive so many interesting work that is being developed in schools, in communities, in legal contexts. You have a wide range of methods, a wide range of professionals that are doing a lot of really strong social impact work in different contexts. And it's so good that, you know, we don't only have nerdish conversations, but we can suddenly be like, oh, I've never heard of such a project. This is really new. This is not my field. And I think that's really inspiring, that we can be in a context that we are open to so many different themes and fields and people who are doing such amazing work. And I have to highlight these in different social political contexts. So I think that creates a lot of awareness also of our work as and our commitment with advocacy and on diminishing inequities across Europe and across the world. And I think EFS and the World Association are in unique places to become aware, to become an advocate, and to promote sexual justice in a very intricate and good way.
Can I just
Thank you very
add,
much,
Elna,
Risha.
on top of these scientific stuff, let me just tell you, as I've been linked in different positions with EFS over the last 15 years, I can tell that it's like a family. The warmth of the, you know, you come as strangers and leave the Congress as lifetime friends. I think this is something very much different from the rest of the other associations. We had an excellent WAS Congress in Turkey where people became friends. People who don't know each other became friends. So I think it's really great. As I said in my talk, I think it's very important. Our worlds are only as large as our connections. And in here, you will feel the warmth and you will be welcomed under any circumstances. So as we said, our motto is without leaving anyone or any groups behind. So I think EFS is such a platform just like WAS, and we are a federation of WAS. So we're learning from each other. And I hope that most of the people here will be able to attend. And I see for students, the fees are quite reasonable. And also for developing countries, we have a special fee. And I think that makes it possible to attend the Congress. And so hopefully most of you will be able to attend, who have attended to these meetings, to make it a successful Congress.
Want to, as the person that's not responsible for the finances of this Congress at all, I want to say to Patrick, who's asking about a sponsorship, knowing from organizing conferences myself, write a letter of motivation to the PCO, because then they can bring it to the board. And then maybe if there is some extra money somewhere, it can be considered. I don't think that they have any bursaries at the moment, but if you write a formal letter with a compelling, that's what we did in Antalya, and we managed to bring quite a few people when we got some extra money. So write the proposal. Patricia, I want to loop back to you and then to you, Stefano, because, another thing I remember from an old conference is I remember you presenting your pleasure research, Patricia, probably 2015, somewhere there, I 13, 15. And you said, you know what, WAS should be focusing on pleasure. And look what happened. I mean, one researcher there in Lisbon, and then it made WAS bring out the sexual pleasure declaration. And if you look at the data, how much more research we now have on pleasure. I mean, even WHO got on board with pleasure. And it comes from an idea of a researcher that presents their work, and then it changes the world. Sorry, I saw my internet was a bit bad there, but I hope my message did still come through, that you're, and I think I want to encourage people, because you think you are just doing local research, but your local research can actually really change the world. Now we know pleasure is extremely political. We're using pleasure for gender equality now, and it's just an example of how things that happen at conferences can change the world. Stefano, I want to ask you about your research. I mean, you're also a career researcher and therapist. Just maybe something from your side of your experience, of something that you've learned at the conference or through EFS, and how you could see that the impact of what you've learned has actually resulted in something happening in your community or something like that.
Yes, well, I think that, for example, some researches that was really important for me were connected with sexual education. So I remember that one of the first time that I have been in a conference in the EFS, it was in Rome. It was 2008, and it was the first time that in Italy we had the opportunity to have the EFS, and I listened to some really important presentations about sexual education in a time that in Italy was not still so developed. And so we started to implement, we started, for example, also to talk about sexual education in primary schools, because before in Italy, the few programs were just for secondary schools. And now, for example, it is something that I continuously do during my routine practice. So I really think that for someone working in the sexuality field, from sexual education, from counseling or psychotherapy, or from the research point of view, of course, it is important to understand which are the best practices and to learn also how you can adapt this practice. It is different from reading an article, even if I like a lot reading articles, but you have the author there, you have the opportunity to exchange with them what they did, which were also their challenges, so you can understand if you have similar challenges, how you can overcome. So it's really, I think conferences are wonderful. I'm always on conferences also now, so I really
Thank
like
you,
them.
Stefano. Stefano Bernardi, I will go to you to ask, why is it that your organization took up this challenge to host the Congress? Because it's just so much work, and it's a big job, and it's often a job that you're not getting a lot of compliments for. You're getting the complaints instead of the compliments. But maybe just a little bit from your side, why you decided to bring it to Bologna, and then Mehmet, hand it back to you to close this webinar after Stefano.
The work is very hard, but the work for all, EFS Congress is work with the EFS and the local committee. We work together, so we want to try to the best for the Congress in Italy, and we want to give the more information and more argument for the all people. Now we want only to arrive in 23 May because we are a little come si dice, non mi viene, just a minute. I stanchi. Stefano, can you please translate for me?
Yes, we are a bit tired.
Yeah, thank you.
Yeah. Okay. So yes, it's tiring, but it's also rewarding. Let's put it that way, because we all get tired, and as time goes by, we are left with the good memories of meetings and so on. So yes, it's always going to be tiring, but to working hard does not really make the mind tired, but makes it more flexible and more rich, I guess, in different senses. So organizing Congress is a great responsibility, and we are all doing it together. Just to make it clear, there's going to be one Italian track, so that people know about that, and the rest will be in English. And so one track is done by all of the Italian federations, and of course, GIS is the association which makes the patronage of all of these things. And we'll be happy to offer our best to all of these people who attend. Financial stuff is not something that we are actually working on, because this is generally the PCO which decides, but we help them. But I hope that most of you can attend. And as Elna has stated, it's always good to, if you are having troubles, to even to cover all the expenses and so on, you can write it, and we'll see if we can find some funds. But at this point, of course, we cannot promise on behalf of anyone, but we will do our best to welcome you, all of you, without leaving anyone behind. I mean, this is not a Congress for the rich, but Congress for everyone. So although we are not really, none of us has the authority to say anything about financial issues, we can try our best. And I would like to thank all of these people who attended today, who shared their precious time with us. And I hope that you got a sense of the Congress at least. And to make it a success, we're hoping that you will all join actively and participate in our Congress. And we'll be more than happy to host you in the best way we can. So thanks a lot, Elna. Thanks a lot to us to giving us the opportunity to talk about our Congress. I would like to thank to all of my friends from the board, the EFS board, and also our hosting person, Stefano, for giving us all the information that we have. As far as I know, I think there are no other questions that we can answer at this point. So I would like to end up by thanking to all of you for being here and sharing with us. Thank you, and hope to
Thank
see
you,
you in
everyone.
Bologna.
Yeah. Thank you so much.
Thank you.
You.